Hi, my name is Barb. I'm one of the nurses at the cardiac rehab program at Thunder Bay Regional Hospital. Today, what we're going to be doing is talking about cardiac medications, just to give you a little bit of basic information about cardiac medications so you can understand the medications that you're taking. So, why are cardiac medications important? So, people living with heart disease often take medication to improve and manage their health. Your doctor will decide on the best combination of medications that are right for your condition and situation. You can work with your pharmacist and healthcare team to ensure that the medications that you're using are the most effective. Now, some of these medications you may need to take for life. Some of them might be prescribed for only a short period of time, say up to a year, and then your physician may decide to stop that medication. Now, a lot of medications, it seems like sometimes when you're first diagnosed with coronary artery disease or heart disease, you put on a lot of different medications, and it can be overwhelming. It seems to be a lot. But each of those medications has its own job. Some are helping protect your heart, improve the linings of your arteries, improving your cholesterol, controlling your blood pressure, preventing blood clots, and some are reducing the amount of work that your heart has to do. So each one is important in its own way. Now, before we go ahead and talk about the medications, I just want to go over some basic anatomy of the heart so you have a little bit of an understanding. So the heart itself is a muscle, and that muscle's job is to pump blood to the rest of our body via arteries, and it returns to the heart via veins. Now, within the heart, there's four chambers. The right and left atrium act as collecting chambers. So they receive blood from the body and then the lungs. And the right and left ventricles act as pumping chambers. And they're pumping that blood out to the rest of the body and to the lungs. Now, that muscle has its own blood supply, and that's delivered by the coronary arteries. So those arteries specifically supply oxygen-rich blood to that heart muscle so that it remains healthy. There's also valves within the heart, and those valves help control the direction of blood flow and prevent blood from flowing backwards within the heart. And to be able to do that pumping action, the heart has an electrical system, and it contracts and it helps pump that blood to the rest of the body. It's also important that you understand what your diagnosis is. And there's a few different types of heart disease. Heart disease is kind of considered an umbrella term, also called cardiovascular disease. Now, these are just a few examples of different types of cardiovascular disease, and it's important for you to know what your diagnosis is. Also important to understand that you may have more than one diagnosis. And a lot of times they can kind of interplay with each other. One can cause another, or they might be completely independent of each other. Now, the first one that when we say cardiovascular disease or heart disease, we often think of what is called coronary artery disease, also known as atherosclerosis. And that's where there's a plaque buildup within those coronary arteries, causing a lack of blood to be flowing to that heart muscle. Often, there's an initial injury, and this starts when we're quite young, and we don't really notice the signs and symptoms at first. Some of the different things that can cause that initial injury are uncontrolled diabetes, uncontrolled blood pressure, chronic stress, cigarette smoking. So there's a lot of different things that can contribute to that initial damage, and then plaque builds up in that area and causes the narrowing. So if there's a lot of narrowing happening, that restricts the blood flow to the heart muscle, which can then cause angina, which is also known as chest pain, which can actually also be described as chest discomfort. So when we say pain, sometimes that makes you think it's going to be really bad. It could be just a pressure, a squeezing, a tightness, a discomfort. So that's important to remember. And if the blood flow becomes very narrowed and restricts it completely or very significantly, that can cause a heart attack, and that's damage to that heart muscle. So again, when we think of heart disease, we're often thinking of that. But there are different types of cardiovascular disease. So when I talked about that electrical system that's causing that heart to pump, that's when there's an issue with the electrical system that can cause an arrhythmia. So an arrhythmia can be your heart beating very slowly, very quickly, or in a disorganized fashion as well. And there's a lot of different things that can cause an arrhythmia, such as environmental, medications, other heart diseases, heart attacks. So it's important to kind of understand where you're at and take your medications appropriately to help manage those arrhythmias. Another problem that can exist is heart valve disease. So there's different types of heart valve disease and different causes of that heart valve disease as well. And valves, again, are present to control that direction of blood flow. Some of the different types of heart valve disease can be stenosis, which is a narrowing. Prolapse is where the valve is slipping out of place. Or regurgitation, which is a leaking of the valves. They're not closing tightly and there can be a backflow. Also congenital disorders. So congenital disorders are where there's a problem with the heart, with either the structure of the heart, how it's formed, or the function of it and that's how it's working. And congenital disorders are present at birth. So a baby is born with congenital disorders, often developing within the womb. And there's a lot of different causes of congenital disorders as well. It could be genetic, it can be environmental. Heart failure, also known as congestive heart failure, is a chronic disease caused by the heart not functioning as it should. It's not able to pump that blood well throughout the body, which can result in various symptoms that need to be managed. So fluid can build up within the lungs, causing some shortness of breath, or it can build up within the feet, legs, abdomen, causing edema or swelling there. So there's different ways to manage heart failure, often through medication or through lifestyle changes. So monitoring those symptoms, being mindful of nutrition that can affect or exacerbate that heart failure. And then cardiomyopathy. Cardiomyopathy is a disease of the heart muscle. There's different types of cardiomyopathy, and again, different causes of cardiomyopathy. And it's important to know what type that you have, and different medications can help manage. But it's basically reducing the ability of that heart to pump blood. Now, these are only some types of heart disease. Again, there are many other types, and it's important for you to have a discussion with your healthcare provider to understand what your diagnosis is. Now, here's a different list of all the different classes of cardiac medications. So all those medications are divided into different classes, and each class is doing something different to help manage your condition. We're not going to go throughout, we're going to break those down as we go ahead and talk about each one a little bit individually. So the first one that we're going to talk about is anticoagulants. But before we go ahead and talk about anticoagulants, I want to show you some different classes. So there's a major class, but then within that there's subclasses for many different classes of medication. So as you see here for anticoagulants, we've got vitamin K antagonists, direct oral anticoagulants, low molecular weight heparins. So those are different classes. And then there's different medication with each of those subclasses. And then also it's important to know that a lot of your medication is going to have two different names. So here we have the generic name, the first ones, and then beside in brackets, we have the trade name. And that's the company name. So another example that you might be familiar with is acetaminophen. Acetaminophen is a medication that's used for pain or fever relief. There's a lot of different kinds, different store brands of acetaminophen, but what you're likely used to it being called is Tylenol. So that's probably what you're familiar with. So Tylenol is acetaminophen. But not all acetaminophen is Tylenol. So it's just important for you to understand that a lot of your medications do have two names. So now we'll talk about a little bit about anticoagulants. So anticoagulants, they're also known as blood thinners. And the reason why is they're helping reduce clots from forming. So people need to take anticoagulants for different reasons. So say if you were having chest discomfort and you went into the hospital, that chest discomfort or that angina might be caused by a lack of oxygen getting to that heart muscle because of a narrowing. So you might be given a low molecular weight heparin. Often enoxaparin is the medication that they do. And that's done as an injection, and it's often given into your stomach. And what it does is it thins that blood out a little bit, allows it to pass by any blockages, and then brings that oxygen-rich blood to the heart muscle, and it helps relieve chest pain. It could also help prevent a heart attack. Sometimes people who have a blood clot, say a DVT in their leg or arm, or a pulmonary embolus, a blood clot in their lung, they will also have to be on a blood thinner. Now, those blood thinners aren't helping break down the clot necessarily, but they're helping prevent it from getting any larger, and they're allowing the blood to flow by any blockage that might be there and continue. There's other reasons too. So somebody who has an irregular heart rate called atrial fibrillation, the way that heart beats is kind of in a disorganized fashion, and it can put people at a higher risk of blood clots forming within the heart. And if that blood clot were to travel to your brain, it could cause a stroke. So people with AFib or atrial fibrillation are at a higher risk of having a stroke than somebody who does not have. So they would often take a blood thinner or an anticoagulant to reduce the risk of that clot being there, therefore reduce their risk of having a stroke. Also, if somebody has had a mechanical heart valve replacement, they're at a higher risk of clots forming as well. Therefore, they take an anticoagulant to help reduce the risk of that clot formation. Now, the low molecular weight heparin will often be started initially, and that because it works very quickly. And often, we used to look at warfarin as the medication that people would take if they had atrial fibrillation or a mechanical valve, or if they needed long-term anticoagulation. Now, warfarin can be a little bit of a picky medication. It interacts with many other things, sometimes dietary restrictions or something that you need to be mindful of. It also has to have an INR done. That's a blood test that has to be done regularly to ensure you're receiving the correct dose of that medication. So there's also other options now, those direct oral anticoagulants, so dabigatran, apixaban, rivaroxaban, edoxaban, those medications for some people can replace the need to have warfarin. In some instances, warfarin is the medication of choice, and that'll be up to your practitioner in a conversation with you. So this is just a little bit of an overview of what I was just talking about, that the benefits and actions. It's helping prevent harmful blood clots from forming, and it can lower the risk of stroke in patients with artificial heart valves or atrial fibrillation. Now, because it's limiting the clot formation, the potential side effects are often related to bleeding. So it's not uncommon to get some nosebleeds, bleeding from the gums if you're brushing too hard, or bruises. So just lightly banging something and you've got bruises on your arms or legs. That's not uncommon, but to be mindful and keep an eye on that. But side effects that you really want to take action on immediately, if you have a bowel movement that looks like a black tarry stool, if you have blood in your urine, if you have vomit that looks like coffee grounds, old coffee grounds, that could signify some bleeding. If you have blood in your sputum or your phlegm, you're coughing up blood or pink-tinged phlegm. Now, specifically for warfarin, we're looking for purplish colored toes. It's called purple toe syndrome. And then also very important to understand, say if you've fallen and hit your head or something else has hit your head, you're watching for signs of stroke, a different kind of stroke. It's a bleeding stroke. So we're watching for severe headache, blurred vision, confusion, one-sided weakness, or facial drooping. Again, there's some things to remember for anticoagulants. Make sure you let all the other practitioners who are involved in your care let them know that you're taking the blood thinners. For example, your dentist or your surgeon, or if you have a gastroenterologist, maybe you're having a colonoscopy or gastroscopy, they will often have you stop a blood thinner prior to a procedure if that procedure is going to put you at a higher risk of bleeding. So make sure you let them know. Sometimes surgeries can be delayed, that kind of thing. So you want to make sure that they understand what you're on. Now, specifically for warfarin, I was saying you had to have that blood test done regularly. That's called an INR because it can interact with a lot of things. Now, one of the things that it can interact with is vitamin K rich foods. So things like spinach, beets, collard greens, kale, Brussels sprouts. What they can do is they can decrease the effectiveness and lower that INR. So now it's not that you have to avoid those foods completely. They're healthy foods. But what you need to do is have kind of a regular amount of it. So say if you went for a long time without any of that kind of vitamin K rich food, and then all of a sudden you had lots, that would have an impact on your INR and your blood work. So it's important to kind of keep things consistent. Warfarin really likes consistency. Same with if make sure you inform your practitioner if there's been any changes to your medication. For example, maybe you go to a walk-in clinic because you have a urinary tract infection. Maybe they prescribe you an antibiotic. It's important that the practitioner who is watching your INR or your warfarin, that they're aware of those other medications that you might be taking. Same with over-the-counter medication. All those things can affect your INR, and that way they'll consider that when they're letting you know if you need to take more or less of that medication. In general, minimize your risk of bleeding. You want to be careful when you're shaving, maybe avoiding contact sports, watch when you're flossing your teeth or not to brush too hard. You are going to take a little bit longer to control that bleeding than when you're not on that medication. And then specifically, rivaroxaban, that one should be taken with a meal, and the other ones should be taken at the same regular time, whatever time you'd be taking it during the day. So the next group of medications is called antiplatelets. And they're also often called blood thinners, but they are different from anticoagulants. So as you see here, ASA or aspirin is an antiplatelet, as are one of these other ones, ticagrelor, clopidogrel, or prasugrel. Now, ASA can be taken alone as an antiplatelet or often taken in combination with one of these other three. And this will be decided with your practitioner. Um, these medications they're helping reduce the risk of dangerous blood clots from forming in the body that may cause a heart attack or stroke. It's done by preventing the blood platelets, these are cells in your body, from sticking together. They're making it so they're a little slippery and they're not likely to form those clots. Now, again, potential side effects, easy bruising, nosebleeds, bleeding gums, but watching for more serious signs as well, black tarry stool, coffee ground vomit, blood in your urine or your sputum. Other side effects could be nausea, heartburn, constipation or diarrhea, vertigo, which is dizziness, ringing in the ears, which is tinnitus. And then specifically with ticagrelor, also known as Brilinta, it can cause shortness of breath. So if you have a new shortness of breath and you're new to this medication, make sure you let your practitioner know. Now, again, some things to think about. Non-steroidal anti-inflammatories can increase the risk of bleeding. So those are things like ibuprofen, naproxen. So be mindful of that and to avoid those and maybe looking at something else for pain relief. Again, letting other practitioners know if you're taking these medications, such as your dentist, surgeon, they'll often have you stop prior to a procedure. It's important to know that cannabis can interact with some antiplatelets. So make sure if some cannabis is something that you use regularly, either abstaining or if it's something that you feel that you're not able to abstain from, talking to your pharmacist or physician to decide on what antiplatelet might be best for you. Now, it is extremely important to take these medications as directed if you have had a stent. So if you had angioplasty done and you had a stent put into your heart, these medications are crucial to prevent a blockage within that stent. Now, if you were to have a blockage within that stent, it could cause a heart attack, it could cause a very severe heart attack, or worse. So it's extremely important that you take those medications as directed. If you ever have trouble affording your medications, make sure you have a conversation with your practitioner or your pharmacist. They may be able to help you. Or, if you need to get your prescription renewed, make sure you go ahead and get that done early enough. And then taking aspirin with food can help decrease stomach irritation. So the next group of medications that we're talking about are ACE inhibitors, also known as angiotensin converting enzyme inhibitors. Now, as you see here, all the common names, all the generic names are ending in pril. So that way in healthcare, we know that they belong to this ACE inhibitor class of medications. We've got ramipril, trandapril, perindopril, lisinopril. But again, also making note that all those medications often have a trade name associated with them. Now, benefits and actions. These may help prevent damage to a heart muscle after a heart attack and prevent further damage to that already weakened heart. They're used to treat high blood pressure and heart failure symptoms, those symptoms of shortness, like fluid in the lungs causing shortness of breath or edema or swelling. What it's doing is relaxing the blood vessels, opening them wider, and decreases then the blood pressure, when it can help prevent strokes, heart attacks, and kidney issues. Now, potential side effects. One common side effect with an ACE inhibitor is a dry cough, which can be common. If you're noticing that you have a nagging cough after starting this medication, make sure you let your practitioner know, because there are alternatives. Now, one that's rare but more serious side effect is called angioedema, and that's a rash, itching, rapid swelling of the face or lips, or trouble breathing. Of course, go into the hospital right away or call 911. Now, we're also watching, so as we lower your blood pressure, we're watching for symptoms of a low blood pressure, such as lightheaded, dizzy, nausea, fatigue, blurred vision, or fainting, or feeling of fainting. It can also change the sense of taste, cause headaches, or stomach upset or diarrhea. Now, some things to know for ACE inhibitors. Non-steroidal anti-inflammatories, so ibuprofen, naproxen, can decrease the effectiveness of ACE inhibitors. So if you take something regularly for pain, make sure you chat with your physician or your pharmacist to see what might be an alternative for you to take. Now, potassium levels and kidney function may be monitored by lab work, so often when you first start this medication as well. ACE inhibitors can increase the potassium levels, so you may be instructed to watch the amount of potassium in your diet. Now, this isn't true for everyone. Everyone's different, so just make sure you have that conversation with your practitioner to see if it's something that you should be aware of. Now, also, because it can lower your blood pressure, often what can happen is when you're changing positions, especially from lying to standing, you can get really lightheaded or dizzy. Now, to be able to reduce that, just make sure you change position slowly. So say if you've been lying down for a while, sit on the side of the bed or couch first, move your legs around a little bit, open and close those hands. Make sure you're feeling okay, and then get up to go. So you don't want to change positions really quickly. And also not to bend head over. So when you're bending down to pick something up or tie your shoes, bending at the knees if you can, or sitting down rather than bending forward. Now, if you're able to, checking your blood pressure will be helpful for your physician or your practitioner to help manage your blood pressure. And then varying the times of day that you take it as well. Not always taking it before you take your medication, maybe taking it throughout the day as well, and see how that medication works. There's many different doses and many different medications that can affect your blood pressure. Often when you're initially started on something, it may need to have a dose adjusted along the way. And then too often when you're in a clinic, your blood pressure might be a little bit higher than normal, that it might be at home. So if you're able, just checking it at home, keeping a little log of that, and sharing it out with your practitioner. So the next group of medications is angiotensin II receptor blockers, also known as ARBs or ARBs. So as you see here, the common names, the generic, they're all ending in sartan. Losartan, telmisartan, candesartan, and then again, their trade names beside them. Now, often prescribed when ACE inhibitors are not tolerated, often are not tolerated because of that cough. They're very similar to ACE inhibitors. They're prescribed for high blood pressure and heart failure to manage symptoms and helping prevent damage to a heart muscle after a heart attack, keeping those blood vessels open and relaxed, which is allowing that blood flow to flow easier. Now again, potential side effects: lightheaded, dizzy, nausea, fatigued, and then watching for that angioedema, that rash, itching, swelling of the face or lips. Now, antiarrhythmics. So antiarrhythmics is a class of medication, but there's a lot of subclasses as well. Some are helping increase your heart rate, some are helping decrease your heart rate, some are helping trying to put your heart rate back into a normal rhythm. So it's depending on the type of arrhythmia you have, the type of medication that would be used. Now we're going to be talking about calcium channel blockers and beta blockers independently on your own. So often when we're talking about antiarrhythmics right now, as I go ahead, we're often talking about the amiodarone, or that's what we're often seeing, and that's often used to treat a lot of the different arrhythmias. Now, it's used to suppress those abnormal rhythms of the heart, such as atrial fibrillation, atrial flutter, ventricular tachycardia, ventricular fibrillation. And if successful, and it puts your heart back into a normal rhythm, it can eliminate the need for long-term anticoagulation with warfarin for some people. Now, often though, sometimes people need to be on both an antiarrhythmic and continue on that anticoagulation if they're in and out of that rhythm. Now, potential side effects could be a worsening of an arrhythmia, chest pain, fainting. It causes photosensitivity, swelling, pain, or numbness of the feet or legs, blurred vision, urine retention, or thyroid issues. Less serious could be diarrhea, nausea, loss of appetite. Now, some considerations to think of. Avoiding grapefruit and herbal supplements containing St. John's wort when taking amiodarone. Because amiodarone is causing photosensitivity, avoiding sunlight, tanning beds, wearing protective clothing or sunscreen when you're out. Having blood work done as directed, because it can affect your thyroid or other issues with maybe your liver. Being mindful that your physician, when they ask you to have that blood work done, making sure you have it done in a timely manner. They might be watching the side effects from some of these medications. And then, of course, reporting any side effects that you have to your practitioner. Even if you think that they're unusual and might not be related, make sure you let them know. The next group is beta blockers, so beta adrenergic blocking agents. So the common names are all ending in lol. We've got atenolol, bisoprolol, metoprolol. Those are common medications that we see. And what they're doing is they're help lowering blood pressure, decreasing heart rate, and making the heart beat more slowly and with less force. It can reduce the chance of another heart attack or having angina, which is chest pain. It's used to treat a variety of cardiac issues such as heart attack, also known as MI, angina, which is chest pain, hypertension, which is high blood pressure, heart failure, arrhythmias, as well as certain tremors and migraines. Now, as it's lowering your blood pressure and heart rate, we could be looking at side effects from too low of a heart rate or too low of a blood pressure that can cause lightheaded, dizzy, nausea, fatigue, headaches. Some beta blockers can cause a worsening of asthma symptoms, can contribute to depression, sleep disturbances, cold hands or feet, sexual dysfunction, so impotence, or overall a lack of energy. Now, make sure you share those side effects if you're having any with your practitioner. Never stop this medication on your own. Make sure you always have those conversations. Now, if you can, record your heart rate and your blood pressure regularly if you're able. Now, if you're not able to, if you don't have a machine that monitors your heart rate and blood pressure, learning how to check your heart rate by holding onto your wrist or your radial pulse, or on one side of your neck, your carotid artery. If you need assistance with that, make sure you let us know when you're here in the clinic, and we can definitely help you learn to do that. Now, beta blockers can also mask some signs of what's called hypoglycemia. That's a low blood sugar. So somebody who has diabetes, who is on medications to help lower your blood sugar, such as insulin, glycoside, that can cause a low blood sugar, they often rely on different signs and symptoms. So shaky, sweaty, nausea, feeling really hungry. Now, beta blockers can mask tremor or palpitations. So might need to rely on other signs and symptoms for that, or checking your blood sugar a little bit more often. So the next group is calcium channel blockers. We've got it broken down here a little bit to dihydropyridine, non-dihydropyridine. It affects their action a little bit. Again, we've got all their generic names here, and knowing that they also have their trade names. So what a calcium channel blocker is doing is relaxing again, or opening up those blood vessels, allowing blood to flow to the heart. That can help control high blood pressure and reduce angina. It can also help the heart work less hard to pump blood throughout your body. The non-dihydropyridine calcium channel blockers can decrease or control irregular heart rates as well. Now, potential side effects: headache, nausea, dizziness, fatigue, edema, which is ankle swelling, facial flushing, or constipation. Now, some things to consider. Again, monitoring your blood pressure and heart rate and record those results if you're able. Avoiding grapefruit if you're on any of these medications. Take the non-DHP on an empty stomach. Never crush or chew a non-DHP extended release tablet or capsule. And this should be the same for any extended release capsule that you have. If you have difficulty swallowing capsules, make sure you have a conversation with your practitioner to see if it's safe to do so. And then again, never suddenly stopping this medication without direction. They may have you wean yourself off of it. Now, diuretics is the next group of medication. They're often called water pills. There's different groupings of water pills as well. The most common one that we see is furosemide or Lasix, but we also see hydrochloride and spironolactone. Now, what diuretics are doing, they're helping manage high blood pressure, and they're also helping manage the heart failure symptoms, so that swelling in your legs or feet, and that fluid in your lungs. And it helps this by helping the kidneys get rid of sodium and water. So basically, you're peeing out that excess water. Now, as we're getting rid of that excess fluid, there's some potential side effects as well. Now, you might not always be on the same dose of a water pill. So the dose may vary. So often, especially if you're in the hospital, they might give you an IV dose of this medication to help get rid of a lot of fluid right away, but then they'll decrease that dose to kind of help just kind of maintain. Now, as we're getting rid of that excess water, we're decreasing the volume, so you can have a low blood pressure. You get lightheaded, dizzy, nausea, fatigued. You can have a bit of an electrolyte imbalance. So some medication are getting rid of potassium, magnesium, and sodium. Some are hanging on to like potassium. So it could be increased, decreased. So you might have some symptoms from that. It may cause some dehydration as we get rid of that excess fluid. Sometimes we get rid of a little bit too much. So you're looking for signs and symptoms of dehydration, which could be decreased amount or dark colored urine, a dry mouth, muscle cramps, weakness, or dry skin. And then also your kidneys might be monitored as well to make sure that there's no kidney complications. Some considerations for diuretics. Now, if you're on it just once a day, taking the pill in the morning is usually best. If you're directed to take it 2 or maybe more times a day, usually taking that last dose or that second dose at supper time. If you take it right before you go to bed, you're going to be up all night in the washroom. So be mindful of that, or get some direction from your pharmacist to decide on the timing that would be best for you. Now, if you have heart failure, you might be referred to a specialized clinic designed to help manage your symptoms. So there's a few different clinics here in town that will closely manage your symptoms. It's important to follow all the directions that are provided to you by taking the medication doses, the fluid intake, so they may have you restricted to maybe 2 liters per day or 1.5 liters of fluid per day. They might want you to measure your weight every day and then watch if you have an increase in a certain time period. They might instruct you to take some extra medication or to contact them. They might have you check your blood pressure daily. They also might want you to be mindful of some nutrition and dietary restrictions could be related to potassium or sodium in your diet. In general, though, limiting the amount of sodium or salt in your diet will help because as we're getting rid of that excess water, if you have a lot of sodium in your diet, that really hangs on to the fluid. So you're kind of working against it. So limiting the amount of sodium. We tend to get a lot of sodium in our diet anyways, so you want to be mindful of that. Unless, of course, you're given other instructions. Some people do have low sodium. So again, having the good conversations with your practitioners. Now, furosemide, also known as Lasix, can cause you to be sensitive to sunlight, so protecting yourself from sun exposure is important. Now, next, we're on to nitrates, also known as nitroglycerin. Now, that can come in various different forms. So there's patches, like a nitro patch or a NitroDur, that's worn on your arm, and you might be worn for like 12 hours a day. Sometimes for some people, they have them on for 24 hours a day. There's nitro paste, which is a paste that you apply, almost like a patch to wear on your arm. We don't see that as often anymore. nitro spray, or you might have tablets that you put on your tongue to treat angina or chest pain, or medications that you take regularly. So the benefits, they're helping relieve that angina by relaxing or opening up those blood vessels and allowing the blood and oxygen to flow. So if you remember at the beginning, we were talking about angina coming from that lack of oxygen getting to that heart muscle. So if we open up those blood vessels, we allow that oxygen to get to that heart muscle, and that can help relieve that pain. Now, potential side effects. Headaches are quite common, but don't let the thought of a headache really deter you from treating your chest discomfort, because that's going to be extremely important. And because we're opening up all the blood vessels, you can have some flushing to your skin. You can have low blood pressure as we're opening up those blood vessels. The blood pressure can drop a bit, so you can get dizzy or lightheaded. So, some things to think about. So, changing position slowly to decrease dizziness. Also, be mindful that taking within 24 hours of Viagra or 48 hours of Cialis can cause a dangerous drop in your blood pressure. So it's important to have a conversation with your practitioner or your pharmacist if you are taking those medications. And if you're ever having chest pain, you're going into a merge, or if you're calling an ambulance, make sure you let them know if you've had those medications recently. Carry the nitro spray or nitro tablets with you and learn how and when to take them properly. If you have any questions about that, you can ask any of the nurses here. We can definitely go over those with you, or talk to your pharmacist. It's important to know when and how to take it. And now if you're on a nitro patch, changing the location of the patch each time you put it on, so alternating arms, dropping it down a little bit from the different place, that can help decrease skin irritation. So another medication, we don't see this as often anymore, but Digitalis, also known as digoxin, it can help manage heart failure, it can help manage irregular heartbeats. It may be prescribed to patients with heart failure who aren't responding to ACE inhibitors or diuretics. It's strengthening the pumping action of the heart and slowing down irregular heart rates. Now, potential side effects, loss of appetite, nausea, vomiting, diarrhea, weakness, and headaches. It can occasionally cause an irregular heart rate. Make sure you let your practitioner know. And if you can, checking and learning how to do your heart rate and recording that. Have blood work that is directed by your practitioner, because they're looking to see how well this medication will be working for you and to see if you need a dose adjustment. Now, there's a lot of different interactions for a digitalis as well, things such as black licorice. So making sure that you chat with your pharmacist or read the insert that comes with that medication to understand the different interactions. So now we're on to cholesterol medications, and there's a lot of different types of cholesterol medications. So it's important to know that we often think of cholesterol as coming from our diet and nutrition, and that is part of where our cholesterol is coming from or impacts. But also there's other factors as well. So our body, our liver is making cholesterol as well. So it's important to, get good sleep hygiene, make sure you quit smoking, become more active, manage stress, as well as take medications regularly to help manage those that cholesterol level. Now, the first one that we're going to talk about are called statins. This group is called statins, and you see why. So atorvastatin, rosuvastatin, simvastatin, they're all ending in statin, so that's why. And of course, knowing their trade names as well. We're often go with the trade names, they're a little bit easier to say. So what it's doing, they're lowering LDL, which is your bad cholesterol, raises HDL, which is your good cholesterol, lowers triglycerides levels. Now, these may be prescribed to patients with high LDL cholesterol, or you might be at risk of heart disease, having other risk factors, and it might be done as a prevention. Now, preventing the liver from producing too much cholesterol. Potential side effects can be muscle pain or muscle weakness. So if you have feeling really achy or really sore, any cramping in your muscles, make sure you let your practitioner know. Also, they're going to be watching your liver function, so get blood work done as directed. Watching, of course, for any medication for allergic reaction. You also might have side effects such as heartburn, dizziness, abdominal pain, or constipation. Now, when to take statins. The elimination half-lives of some statins determines whether it should be taken at bedtime or not. To maximize the effects of statins with a short half-life, such as fluvastatin, lovastatin, or simvastatin, those ones need to be taken at bedtime. This allows the greatest drug concentration to be present during the peak hours of production of cholesterol by the liver, which is midnight to 5 a.m. Now, on the other hand, medications such as atorvastatin, pravastatin, and rosuvastatin, they have that long half-life, so it allows flexibility. So you don't have to take that one at bedtime, especially if you're always forgetting that lone medication at bedtime. Talk to your pharmacist. You can often take it in the morning or at supper, whenever it's going to be easier for you to remember to take that. So another group of cholesterol medications is fibrates. So lowering LDL and triglycerides, raising that HDL, again prescribed with elevated levels or normal levels, but have other risk factors for cardiovascular disease. It blocks the production of certain types of cholesterol and increases the good cholesterol. The potential side effects: stomach pain, gas, heartburn. Common names: Lipidyl, Bezalip, or Lopin. Next group is absorption inhibitors. It works by decreasing the absorption of cholesterol in the small intestines. It may be taken alone or in combination with a statin or a fibrate. Precautions: anyone with liver disease or unexplained increase in their liver enzymes. Again, watching for any muscle aches, pains, or weakness, having blood work done regularly as directed to monitor the liver function. Watching again for any allergies, and also could contribute to heartburn, dizziness, or abdominal pain. And the common name here is Ezetrol. Another medication here is a PCSK9 inhibitor. So LDL cholesterol, that bad cholesterol, is removed from the blood by binding to receptor sites on our liver cells. PCSK9 is a protein that's made by the liver that lowers the number of those receptor sites available. So this medication, a PCSK9 inhibitor, blocks that protein, therefore increases the number of receptor sites that are available to remove that LDL. Now, potential side effects: runny nose, sore throat, symptoms of cold or flu, back pain, increase in blood sugar, or redness or pain at the injection site, because this is an injection. Now, the common names are Repatha or Praluent. Another grouping of medications, a common name here is Vascepa. Again, used along with some lifestyle changes. It can decrease the triglycerides that are made by the body. I think the exact mechanism is unknown. Now, potential side effects: muscle joint pain, swelling of the hands, legs, or feet, gout, constipation, heart rhythm issues, palpitations such as atrial fibrillation, possible allergic reactions. Now, these ones too can interact with some anticoagulants or antiplatelets and should not be taken with other over-the-counter omega-3 supplements. Some other cardiac medications that you might come across: Entresto is a combination medication that can help lower the risk of hospitalization in patients who have chronic heart failure. SGLT2 inhibitors are a medication initially for type 2 diabetes and still used to treat type 2 diabetes, but it's been shown to help decrease cardiovascular disease with type 2 diabetes, and also has been used to treat chronic heart disease or congestive heart failure. Now, those are your cardiac medications, and the first step in managing your medication is to know what you're taking. So many times over the years, I've had a lot of patients say, well, I take that blue one in the morning, and there's that yellow one at supper. So it's important for you to understand what your medications are, why you're taking them, even what they look like. Being able to point them out if you have, like, say, a blister pack is important. Knowing the common names for them, and then some of the common side effects as well. I also wanted to go over some helpful hints for medications in general. Now, if a dose is missed, take as soon as possible that you've remembered it. But if you are nearing up for the, next close to the next dose, it's going to be safer for you to skip the missed dose rather than double up very close together. Now, different medications are going to have different timelines. So if you've forgotten your medications, a few hours have gone by, maybe call your pharmacist for direction on whether it's safe to go ahead and take that one. Now, it's easy enough to forget medications. Consider using a blister pack or a dosette. So a dosette is got the Monday, Tuesday, Wednesday, it's each day, and you put your medication in there. It'll help. It's easy enough to get through your day and think, did I take my medication? That way, with a blister pack, you can look, okay, yep, Tuesday morning, they're gone. I've taken them. So it's important to kind of, make sure that you're not doubling up. Now, make sure you let your practitioner know if you have been missing doses, especially multiple doses. Now, say if you went into their clinic, they were doing your blood pressure, it was very high. Oh, they're thinking, oh, we might need to increase that blood pressure medication. But if they didn't realize that you had missed the last couple of days, it's important information for them to have to make sure that they get you on the appropriate dose. Now, make sure you have a complete list of all your medications handy with you. Carry it in your purse or your wallet. Include all your medications. People tend to be really good at listing all their pills on there, but sometimes they forget about injected medications such as insulin or other medications. They maybe forget patches, creams, inhalers, or supplements. Include medications that you take on an as needed basis as well on that list. Now, the best list is maybe one from your pharmacy. You can get that done with them, and it'll have all the details on there. If you are handwriting a list yourself or typing one out, make sure you're including all the information on there. For example, so if you're taking a pill and say it's 5 milligram tablet, but if you're only taking half of that tablet, make sure you include that on your list. Also, how many times a day? There are some medications that are only ever going to be taken once a day, and we know that. But there are some medications that might be taken once a day, maybe twice a day, maybe 3 times a day. So it's important to include that on your list. And then also any supplements or vitamins or over-the-counters that you're taking as well. Now, it's important to make sure you don't share your medications with anyone. Now, it might seem like, oh, my friend or my partner, they have the same diagnosis as I do. Maybe this medication will help them if they're having symptoms. The thing is, they might have other health issues that would be contraindicated to take that medication. They might be on something similar that interacts poorly with that medication. So everyone is individual. It's important to make sure that you're not sharing those medications with other people. Continue taking your medications even if you're feeling well. I've had a lot of people over the years say, I stopped taking my blood pressure medication. My blood pressure was really good. Well, your blood pressure might have been good because you were taking that blood pressure medication. So again, important to keep taking. If you're having concerns about the number of medications that you're on or maybe the side effects that you're having, make sure you have that conversation. Of course, if it's serious side effects, bleeding, that kind of thing, allergic reaction, go on into Emerge. They can help adjust your medication as well. Now, as you see, as we talked about all these different medications, a lot of them shared similar side effects, that lightheaded, dizzy, symptoms of too low of blood pressure, those kind of thing. So some of those medications are going to be more important than others, or they might look at decreasing a dose rather than stopping something altogether. So even if you're feeling unwell, again, having that conversation and not to take, taking your own action on it. Again, having blood work done as directed. So there's a lot of different reasons that you might have to have blood work done for your medications. We might be looking at different side effects. We might be looking at, your electrolyte levels, your thyroid levels, might be seeing how well that medication is working. Do you need an increase or a decrease? How are your kidney functioning or your liver functioning? Because that's how medications get removed from your body. So it's important to kind of have all that blood work done in a timely fashion, as directed by your physician, to make sure that you're healthy, things are going well, and the medication's working properly. And just know your medications, know what you're taking, why you're taking it. There's different resources that you can explore. Your local pharmacist is going to be one of your number one. So there's a program called Meds Check, and that allows you to schedule a 20 to 30 minute one-on-one meeting with your community pharmacist to ensure that everything is good. So It's very easy if you have a lot of different practitioners. Maybe you have a family doctor, or a nurse practitioner, a cardiologist, a cardiovascular surgeon out of town. Maybe you went to a walk-in for something or a merge. There's a lot of different practitioners that might be ordering medications for you. So if you go to the same pharmacy all the time, they'll be able to pick up if there's any interactions, or maybe something you've got two medications from the same class, a class of medications that you shouldn't be. So making sure you go to that same pharmacist all the time, having that one-on-one with them so they can make a really good list for you as well and answer any questions that you have. Also, some different websites. Ottawa Heart Institute, the Heart and Stroke Foundation has an excellent website for everything heart related. Um, how to take your medication safely, Ontario government. So there's a lot of different resources. Now, when I say there's a lot of different resources, there's a lot of good resources and there's a lot of questionable resources as well. So always understand where your information is coming from. Make sure you go to a well-researched and non-biased site, especially online. Online, there a lot of people are trying to sell you something. They don't have your best interest in mind. So always questioning where that information is coming from and going with, really well-researched sites as well to know that you're getting the most, helpful information. Okay, well, that was cardiac medications, a little bit of an overhaul. Thank you for staying with me. If you have any questions at any time, feel free to talk to your case manager. They can chat with one of the nurses. You can have a sit down with us. Or again, your practitioner or your community pharmacist are going to be invaluable resources to you as well. And at any time, feel free to contact us here at the clinic. Have a good day.